based on some data that we have, it is becoming more likely that those that are testing positive have Omicron versus Delta. We are right about at that tipping point based on data that we've been able to see.
We are seeing more daily new COVID cases in the U.S. right now than any other time during the pandemic. Omicron is spreading rapidly, and while its symptoms are generally less severe for healthy people, our hospitals are strained.
We have more than 2,300 COVID patients in our hospitals in Arizona right now. And the largest hospital system in the state is now preparing for a post-holiday surge in additional cases. Brittany Thomason's joining us live with the latest from Banner Health today. Brittany.
Yes, from pausing monoclonal antibody treatments to evaluating patients for a new COVID medication. Banner Health is trying to prepare for that Omicron January surge after the holiday get-togethers. But it's still to be determined just how much Omicron will affect hospital numbers.
Inpatient volumes remain at high levels, with some Banner hospitals operating above 100% capacity.
As the chief clinical officer for Banner Health, Dr. Marjorie Bessel shares the same thing we've been hearing from other hospitals. They're strained, yet preparing for an even bigger surge.
We expect that volumes will continue to increase through the beginning of next year before peaking around the middle of January.
Right now, about 40% of Banner's ICU patients are for COVID. 90% of them are unvaccinated. But Dr. Bessel says Omicron is causing more breakthrough infections, especially in people who don't have their booster shots. Banner has been using several brands of monoclonal antibodies to treat patients, but Bessel says they don't work as well with Omicron.
A different monoclonal antibody, Sotrovimab, is efficacious, but there is no supply of Sotrovimab in Banner Health facilities at this time.
Starting today, the hospital system is pausing antibody treatments until it gets the more effective one, expected to arrive next week. The good news is a new medication may be able to reduce hospitalizations.
Effective today, a new oral antiviral medication against COVID is available and can be prescribed by your physician. Initial supplies of this drug are also going to be extremely limited, and so the medication will be used for patients who are at highest risk for hospitalization and meet strict criteria.
Banner says it has limited ICU beds available. It's asking people to skip the emergency room and go to an urgent care if you need to see a doctor, but it's not serious. Live in Scottsdale, Brittany Thomason, Arizona's Family.